It is Wednesday, July 22nd, 2009. I'm Will.
I'm Rob.
And this is Political Lunch.
Welcome back to your Wednesday lunch today. As promised, we start with a primer on the healthcare reform plans currently making their way through Congress.
Now, this is just the Cliff Notes version, but hopefully it's enough so that you might understand what the fuss is about and how it may or may not affect you.
First, the so-called Obama plan. Of course, the president doesn't actually write legislation, so his reform plan is basically a set of policy suggestions. But his plan has nonetheless informed the majority of congressional debate on the subject, so that's where we will start.
The president, along with most people who've been paying attention, have identified two basic problems with the nation's current healthcare scheme. First, too many Americans don't have access to affordable health insurance, and second, the overall cost of healthcare in America is just plain too high.
On that first point, health insurance, Congress right now is working around the principle that everyone should have health insurance coverage, that they should have access to care, that they should get into a program, and that they should remain insured forever.
And while that may sound like, well, the right thing to do, the good news is it's also the smart thing to do, since getting everyone into the insurance system will help spread out the cost of the higher risk patients, the very young, the very old, and the very sick.
Now, if everybody's contributing in one way or another to the insurance pool and everybody's receiving benefits, simple logic tells us that overall costs for providing healthcare should drop. And so by increasing access to the pool of health insurance, we'll at least start to address that second issue, the skyrocketing cost of care.
On that point, no one is really in disagreement. But the real fun starts when you try to find consensus on how best to get everyone into the insurance system and how to pay for it. Now, of course, the hallmark of the president's proposal is a public insurance option. He and most Democrats in Congress agree that a federally managed insurance option would increase access to affordable coverage while also keeping private insurance companies' rates down.
Now, the Republicans, meanwhile, say that plan would create yet another inefficient government entitlement program and that it could drive the private insurers out of business. The bottom line, though, is that the Democrats have the majority. The GOP and the insurance lobby will fight the public insurance option tooth and nail, but in all likelihood, it will become a reality.
That is, unless Congress can't come up with a way to pay for it, and that's where the Democratic majority looks somewhat less invincible. A group of fiscally conservative so-called blue dog Democrats have been rattling the president's chain over the expected cost of that program, which some in the Congressional Budget Office have said will likely top $1 trillion over the next 10 years.
The president has outlined some spending cuts designated to go toward healthcare reform, but they won't come close to covering it, so ultimately someone, somewhere, is going to face a tax increase.
Now, the idea du jour is a tax on employer-provided healthcare benefits. Right now, if you get health insurance through your employer, no one's paying tax on that, even though in reality that benefit is basically the same thing as cash, and companies avoid some $200 billion a year in taxes by deducting the value of health insurance benefits they provide to their workers.
Ending that deduction is a popular idea among Democrats and Republicans in the Senate Finance Committee, but labor unions aren't thrilled with the idea since it likely means many of their workers will see benefits decrease. Also, President Obama campaigned against the idea and has vowed not to raise taxes on those earning less than $200,000 a year, which this in effect would do, but he has signaled that he would not veto a healthcare reform bill that contains this new tax on benefits.
Okay, so far we've covered the major components of the bill that will likely win approval in one form or another in the next few months, but there are two other sticking points that could determine whether that package of reforms succeeds or fails.
First, there's the fact that the president's plan will work only if everyone gets covered, and most people won't be given insurance for free, so how do you compel people to buy into the new and improved insurance system?
So far, Congress doesn't have a clear answer for that. Now, the Republicans favor a system of tax incentives, and there's the possibility of a system that everyone is automatically enrolled in and must opt out of if they have other coverage. But the bottom line is that the economics of this whole thing won't work if insurance coverage rates don't increase to somewhere near 100%.
There's also the question of improving the private insurance system, which would still provide coverage to the majority of Americans. Right now, that's a system plagued with inefficiencies. It's confusing, it's expensive, and it often gets in the way of patient care.
Now, to address those issues, Congress is developing what Politico has referred to as orbits for Insurance. That's a marketplace where employers and individuals can compare benefits, options, coverage limits, and buy insurance. Now, companies would be required to accept everyone regardless of pre-existing conditions, and workers could take their coverage from job to job.
That marketplace is the one piece of the reform package that gets almost universal approval among members of Congress, maybe because they've had access to just such a system themselves, the Federal Employees Health Benefits Program, and they've promised for years to provide the same options to the rest of us.
Awfully big of them. So that's your health care reform primer. Now, for more information, check out that great piece from Politico that we just showed you, or go to thehealthcareblog.com. Also, tonight at 8 p.m., the President will hold a White House press conference on the subject of health care reform.
And on Monday, we'll be back with part 2 of what's become our healthcare reform series. We'll explain just how you would be affected by the proposed changes.
In the meantime, we will, of course, be back on Friday with your weekly 10 and 3. Thanks for watching. We'll see you then.